Hello everyone, welcome back to the module 3. In this session we will be discussing about general X-ray imaging safety. Two simple content we will be explaining here. One is radiation hazards in conventional radiography and patient dose reduction technique in X-rays. As we know, when we are comparing with the radiation doses which is used in radiotherapy and in CT, in conventional radiography, the radiation dose is comparatively lesser. But we can't neglect the radiation dose which is coming out from the conventional X-ray machines. So conventional radiography uses ionizing radiation X-rays capable of damaging living tissues by ionization of atoms and molecules. Biological damage occur mainly through DNA strand breaks and cellular dysfunction. So hazard severity depends on radiation dose, exposure frequency, exposure time, and radiosensitivity of a tissue. So although diagnostic doses are low, cumulative exposure increases the long-term risk. So there are two types of radiation hazards in conventional radiology: occupational hazard and patient hazards. Occupational hazards arise from scattered radiation, poor shielding, improper positioning and lack of monitoring, and patient hazards include unnecessary repeated exposure to the patient. Poor technique selection, the KVP and MAS we should select smartly, and higher risk in pediatric and pregnant patients. This improper selection of this technical factors are having a high risk in particularly in pediatrics and pregnant patients. When we come to the types of radiation effects in conventional radiology, we already discussed this, the deterministic effect and stochastic effect. The stochastic effect, the radiation effects with no threshold, where probability increases with dose but severity is independent of dose. In non-stochastic effect is nothing but deterministic effect, radiation effect with a threshold. There is a threshold you can see in the deterministic effect. So where severity increases with dose due to tissue damage. So what all are the patient dose reduction techniques in X-rays? We have beam limiting devices and technical optimization. What all are the beam limitations? We have positive beam limiting devices, aperture diaphragm, collimator, cones, cylinders. These all equipment devices we have to make use of it. So tight collimation limits exposed anatomy and reduces absorbed dose. And proper centering prevent repeated examination, use of appropriate KVP and MAS. All the technical factors should be selected wisely. This combination KVP MAS combination reduces the dose without degrading diagnostic image quality. Image quality is should be there, but we are not doing it for a fantastic image quality. We are doing it for optimum image quality with an optimized dose to the patient. Also follow the time distance shielding TDS principle, that the cardinal principle of radiation protection. Also avoid unnecessary grid usage of the grid, specifically for pediatric patient and lean patient with very thin patients. You can avoid using the grids, because the function of grid, we know that the grid is not reducing the exposure. We have to increase the exposure factors while using a grid, because the many scattered radiation will be absorbed by the grid, only quality radiation will pass through. So we are forcefully increase the radiation technical factors to get a better image quality by using the grid. So avoid using the grids while imaging the pediatric patient as well as the pregnant patients. The other patient dose reduction techniques involve filtration, shielding, and equipment design. Filtration, we know that added filtration, aluminum filters which removes low energy photon, which is particularly responsible for excessive skin dose. Also use of modern digital detectors increases dose efficiency compared to film screen systems. All the modern detectors which is having higher absorption efficiency, capture efficiency, with better efficiency, the modern detectors are uh, can significantly reduce the radiation dose when we compare with the film screen system, the conventional method. Also, regular equipment quality control ensure appropriate dose delivery. So always we should have a check appropriately, yearly, half yearly, or the quality control test should be performed, and we have to make sure that the machine is working appropriately, and we can match the results of that particular quality control test with its actual values. So also we have to use lead shielding protection devices, such as lead aprons, also lead goggles, lead thyroid shield. All this equipment can be used to protect the sensitive organs such as gonad, thyroid, breast, etc.